meet Dr. Joseph Mina Atala. Dr. Atala, welcome.
Thank you. Thank you for having me, Doc. And we're very happy and we're very impressed with all the videos that you're doing.
I can see that you're in the back of your office, so you're back to work already?
Yep. We're trying to get back the schedule. We're getting the yellow light now. So gradually we're starting to put the patients again, but making sure that only one patient at a time at the office. And we're getting the ball to roll again.
And where are you located?
We're located in Tustin, California.
So what does it mean that when you have the yellow light? Does it mean that is that a full
We're starting to go back to work, but we're trying to be a little bit more careful with having the social distancing and making sure there's only one patient at a time at the office. We're seeing only 3 to 5 patients a day instead of like before we used to say 10 to 15 patients a day. We're taking more precautions. We're making sure that the door is closed, the aerosol, like the ultraviolet between the patients is on, and the air itself. We're trying to make sure that it's as clean as possible, all of the air filters, and giving some times for the room to be clean as well.
We're jumping too quickly on the subject. Let's go back a little bit. Can you please introduce yourself and to tell our public who you are and what you're doing?
I'm a dentist. I'm originally from Egypt. I had British and Egyptian education back there, and I studied here in the US as well. I've studied in Mexico and Germany, and dentistry is my hobby. So I like seeing different kind of perspectives in every different schooling system and getting the pros and cons in every one of them and trying to blend them all as much as I can. And recently for the last 6 years, I've been practicing here in California in Tustin after being here and there and a few other places. So dentistry is my hobby. I enjoy it.
Yeah, you mentioned something very interesting that dentistry is your hobby. What I've spoken to so many of our colleagues that dentistry is kind of it's the burden. They've been dropped into this field and now they have to roll the ball further down the road. Now for you it's a hobby. Can you explain that?
I love the medical part of it. I love the surgical part. My dad was a surgeon, and all my childhood I've been dreaming about being a surgeon as well and a doctor. And I also loved architecture and interior designing, and I was thinking about being an architect as well. And then dentistry came in to be the perfect blend between both of them. I like working with my hands. I like the idea of having your own office and not running between hospitals, but your small office to be your own surgical room, your own operating room, and your porcelain lab. You can play and take your time playing with the porcelain, with the colors, the aesthetics. And at the same time, there's a little bit of orthopedic surgery with all the implants. There's a little bit of architecture, a little bit of physics, and dentistry blends them all at the same time. So as a dentist, you do a little bit of an orthopedic work, you do a little bit of like artwork with the lab, microplastic surgery with the suturing techniques, and you blend them all at the same place, in your place, with your own music, with your own view, with your own setup, and there's nothing that matches that.
So you had your fun playing with dentistry and all parts of it, but that was before COVID. And then COVID hit us. We've been put on pause for 3 months. Tell me what changed within those 3 months?
Dr. Keanu Shah, what he came up with the idea of, guys, let's do the conference that we're doing, let's do it online. Let's make it live. Let's do the webinars and peer-to-peer concept between the doctors. And the amount of excitement that we all had to plan this, to do this, was unbelievable. And he pushed all of us and to actually do it. The idea is, as long as we're sitting at home, as long as we're not doing much, let's learn at least. Let's share experience. Let's remember what dentistry is all about. Let's see things from different perspectives, from different corners. Let's get different schooling systems. the people and a lot of doctors that designed implants, let's understand their philosophy behind these designs, these concepts. Other doctors that came up with different techniques, let's understand these techniques. Researchers, clinicians. We had someone like Professor, like Dr. Nesnik with all the designs, and then Frank Zastrow from Germany, and then a lot of different perspectives, different schooling system, different mind thoughts, and they're all blending in one place. We're all sharing it, we're all explaining it, we're all experiencing it. It was just an amazing experience for all of us.
So you used the COVID pause to bank on your C credit, but now
Yeah,
that the pause is over, would you keep doing this?
we got so addicted to it, and and the doctors and everyone had a huge, an amazing time doing it, and we got such a huge positive feedback from all the doctors around the world, and everyone was really appreciating it because you're getting an immense amount of information that is worth tens of thousands of dollars for free and at your home, at your convenience, anytime. And the lectures are all safe too for you to come back to it anytime. So it's a very strong educational system that is just all there for you. Um, so we started, why should we stop? Let's keep going it. So every weekend now they're trying to put 1 or 2 lectures here and there. So even though we're not doing it every day as before, but at least every weekend we have the time to do a few lectures as well. And uh, Dr. Shah's philosophy, uh, I used to listen to him a lot. Like we used to work together, so I used to listen to his ideas and concepts and about uniting all the healthcare professionals in one place, one spot, to do a lot of things. Part of the educational part of the business part of it getting back the grip on healthcare instead of it being lost in the system with all the insurance companies and everything. And I felt his ideas were very intelligent. If he's able to one day implement that, that would be impeccable. And he actually did it. And he pushed all of us to actually do it. Just if you've seen the pieces of the puzzles that he's connecting all together, from the educational part to the empowering the healthcare peers all together to come in and unite and have this weight in the healthcare system is very impressive.
So you're telling me that right now it's every weekend, it is free and it's global.
Yes.
Um, and you would you think that this will be replacing the way that we consume dentistry on a training base?
We, again, like at some point we're going to get back to working on the clinical level and the cadavers and the hands-on courses. Of course, it's going to be always there, but the whole concept of the word university itself is coming from unity and diversity. So we're trying to unite as much as possible all this diverse information, all this diverse different thoughts, all this literature out there, all these doctors that went through the literature and got the sense of what's actually applicable and what's true out of it and what's not. We're trying to get all these decades of experiences from doctors with the British schooling system, with the American schooling system, with the German dental schooling system, and we're trying to blend them all in one place with all the agreement and disagreement in it, and to give us more the sense of a deeper sense of understanding. So later on, instead of just standardizing and generalizing, we go a little bit more further. We start to personalize things per patient. We have a deeper understanding to things, not how just to do it, but why is it so? And this is the whole philosophy of this webinars. And peer-to-peer is not just what we agree on, it's what we disagree on. And let's see a more refined line to what actually is true and how we can mix and match all this information per patient. per procedure.
There's so much wisdom you just said in this long answer. Because I'm starting with the fact that you said that university, it's unity and diversity all in one. It's, you know, I'm writing books. This is the stuff I can write about all day long. And then
you wrote books.
Actually, I hate books. I'm lazy, but
Don't believe that.
it's a mean to communicate.
Yeah.
But what I like is the concept. What I like is the ideas. And when you say that diversity, it should be, it's not universal. It's unity and diversity put together. And you said that to the end result of that, it was to, instead of standardize everything, is to personalize things.
Yes.
This is huge.
A lot of the literature out there, a lot of the research, a lot of them are guided by the dental companies themselves. And some of them are very authentic, and some of them, the inclusion and exclusion criteria in every single research can differ to push you to show different results other than the actual pinpoint reality. So by seeing more, by being more diverse, by exploring more, by comparative analysis more, we can have a better sense of what the actual reality is. So we throw all this information in an ocean, and we start refining it a little bit by a little bit, and then it gives us a better sense of what the reality of each situation is, rather than just generalizing it, standardizing it. A more personalized art is a more valuable art. We tend to get so used in healthcare in the United States now that everything is coded. We're trying to code the brush stroke in an art. And this standardization got our mind to be more wired to generalize and simplify things, which is good to decrease error. But at the same time, this is not the best thing for the patient sometimes. So the more you blend in, the more you see the differences, the more you can experience why is it so, will have a deeper understanding, and you can personalize the treatment accordingly to that patient, rather than just simplifying it and standardizing it in every time. If it makes sense?
Absolutely. I think that this doesn't make sense. It's just the beginning of a renewal of a passion, because you said at the beginning you love dentistry, it's your hobby. Yes. And I've been talking to so many people within this confinement. Many people were complaining that I don't know where I'm going. I am just tired of going back to this again. But you just brought something on the table that the main idea here is we've been numb in a standardization. And if you're trying to find some life through this, go back to the university, to the unity from the diversity. And if you find your passion, we need people like you to bring this passion back on the table to fuse science and art. This is what you're telling me.
Yes, exactly. Again, dentistry, there's a lot of engineering part if you want to get involved in it. There's a lot of surgical part and microplastic surgical part, which is very challenging and interesting. And at the same time, we're the only doctors that have the right to be playing with different kinds of colors of porcelain and translucency and refractive index. So there's enormous amount of art too. So your dental office is your art gallery, your mini hospital, your and your own playground. Think of it this way. This is what I always tell my patients. This is my playground. And the patient loves it. So it doesn't change the fact, though, that probably in the United States, we're the only country around the world that the front office is bigger in most of the offices than the operating rooms. So the amount of paperwork and the amount of drainage that we see by the insurances and paperwork is sucking up a lot from the quality that we can provide to our patients, and from the time that we can be giving to excel in the treatment. We're standardizing so much to the extent that we lost the sense of art that dentistry has to offer. Uh, in Germany, for example, there are labs and that can do you crowns that look exactly like the natural tooth before it broke. These crowns can cost you between 10 to 15,000 euro. But they do the crowns in a way that not even a dentist can tell that this is a crown. They do the crown as if they're doing it for Shakespeare or Goethe, with the craze lines, with the stain lines. They want to have all the pipe stains with wine stains, with the mix of life in this tooth to look and blend in with the rest of the teeth perfectly. And this is what the patient wants. It's not just white piano chiclets kind of looking thing. It's just one tooth that are going to spend a whole week or month or day or whatever it is just to mimic it and challenge themselves that not even a dentist can tell that this is a crown. This is a completely different level of art than just coding things and standardizing things and the insurance is putting price on something. You should think of every single treatment as you're an architect and you have this project of designing that house this month. One treatment can be enough for a whole month. Like there's some doctors that take only 10 procedures, 10 patients a year, or 15 maximum like a year. And then think of every single patient as a project. And this is what dentistry is. We can't be having patients thinking or justifying spending $30,000 to $50,000 on upgrading their kitchen, but they're not justifying paying that amount of money on upgrading their facial structure. This is the whole concept needs to be reevaluated.
You have to explain to me something, Dr. Atala, because I'm now intrigued. You can be involved in a global initiative about changing the way that we communicate and educate ourselves on a peer-to-peer from all around the world. And then you can speak with passion about one single tooth that might take a week and cost 10 to 15 euros. How do you cope with such different scales? Because you go from the huge and the big to the micro with the same passion.
This is what it is. This is the most like enjoyable part of being in healthcare. In healthcare, we do the surgeries. We think about the macro, what you can see with our own eyes. Yet at the same time, in school, we study everything to the microscopic level. And we study things to the microscopic level because of precision and because everything is depending on each other. So it's an ocean of information. It's an ocean of art that you can take with the aesthetic part of dentistry. It's an ocean of mechanics and engineering and architecture part that you can dive in as well. And at the same time, there is tons of potential and opportunities with all the prosthetic parts and all the surgical techniques that we can implement in all the procedures. And the more you understand, the more you can come up with new different techniques every day. And it serves us. Through generations, it serves us well. We have, every generation, there's peers and clinicians and surgeons that are very creative that come up with new skills that the second generation learns from, and we implement it, and it serves healthcare well. With the science, implemented with the surgical skills, with the new designs, and we blend all this together, this unity, and we come up with the best treatment for the patient as much as we can. And it's enjoyable for us too, because it's make your day more challenging. Your day is not simple, same everyday crown fillings and that's it. No. Your disguises are your limits. You can work under microscope in your lab, in your porcelain lab, doing things as precise as you can. And you can do the surgical parts under microscope too, with all the microsurgical sutures and techniques and everything as well, while working on the implant designs and understanding why is it so, and picking and choosing accordingly to each and every treatment as well.
So, sir, if
And
I
this
understand
is,
you right, it's you like challenge while most dentists are trying to move away from the risk factor, you will embrace it. Is that what you're telling
yeah,
me?
yes, this is true. We standardize what we can standardize to avoid errors. That's for sure. So we have to have a standard, or else like things are going to be so cerebral, and there's going to be a lot of uh, like trials in the patient's mouth. We don't want that. But yet at the same time, when things are hard and challenging in the patient's mouth, we should not go back and just lay our back to the wall and say we don't know what to do. No, no, no. There's always something that we can do. And there's always something, and this is beautifully implemented in all the podinars and the webinars that we're doing, because you can see all these diversity and all these mindsets and all um, uh, like enormous experience, decades of experience from clinicians and doctors that are focused on some aspect of dentistry and implant dentistry, and another doctors that focus on the other aspects of implant dentistry, and so on, so on, so, and you implement all this together, and it opens up so many uh, ideas and so many uh, thought processes.
So now
And
I get how you get to the hobby thing. It's you're trying to provoke, not to provoke, but if the student present itself to face a big challenge and you document it. And then you have a stage, a worldwide stage, to just share with the world what you've been through. So many you put yourself in a position to have something to yeah to tell. You're looking for a story, and this is what make your life so interesting. Is this your hobby you're talking about?
this is yes. Like I got a chance to have British, Egyptian, Mexican, American, and German education, and I can see how the mindsets is very different, and different way of thinking. And the more you see this diversity, the more it opens your eyes to think a little bit more and more and more, and uh, you get the sense of the pros and cons in each one, and you try to understand rather than just memorize and standardize. And again, it reminds you with what university is all about: unity and diversity. All this diverse information, we throw it in one place, and it opens our mind to personalize more and understand more.
So you throw
Uh,
so many great concepts. Yeah, and you said that we have to stop memorizing and to start to understand. And this is mainly, this is look good on paper. This is what we've been told before we get into dental school, and but after that, they expect us to just swallow and to reproduce again the same thing. But to understand, this takes time. This takes passion. This takes dedication. And based on what you tell me, especially with the concept of university, it's you have to understand, but then you have to stay humble to be ready to learn again. And this is
exactly.
what I think keeps you in the hobbyist part of dentistry because it's still fun for you.
Yes, and like again, like every time we look back to the literature, to the research and everything, a lot of things that we used to believe and think this is 100% true and this and that, after 20, 30 years later on, we discovered this was one of the biggest mistakes we've ever done. And it humbles us, exactly what you said. And it makes us look and think differently and reevaluate things, um, and be better listeners. So, for example, when I started doing implants like 15 years ago, I used to shadow this doctor that he used to be known to place some of the highest number of implants in where I used to live. And I've been always seeing the same things with the implants coming out after 20, 30 years, that a lot of bone loss, a lot of soft tissue loss, and wondering why we're not using smaller implants. And from our understanding to how the energy dissipate and this and this and that, now more than 30, 40 years afterwards, it have been mentioned multiple times, and especially even from the president of the German Society of Oral Implantology, Dr. Frank Schwartz in the DGI, that the biggest mistake we've ever done in implant history is large white implants. We used to think the bigger the implants, the stronger it is, the lesser the dissipation and the better emergence profile. And then we started realizing, wait a second, it's much more valuable to have more bone, more soft tissue around the implants. And if the implants is completely submerged with the platform switch, the energy doesn't dissipate the way it does. And the margins of the crowns are not coming out of the same place where we're placing the implants. And it's a whole paradigm shift. And this is just one of the examples in science in general. Like a lot of things that we've known to be the way it should be and the way it is, we started realizing, no, let's think from a different perspective. Let's think this and that. And then through generations and every 20, 30 years, 50% of what we know have already completely changed. And this is why we need more diversity, more mindsets, more thoughts, more evaluation to the inclusion and exclusion criteria for each and every single research. We have to refine the information. And we have to also have in mind that truth as a category does exist. Having different perspective does not change the fact that truth as a category does exist. And putting both of them in balance can get us the best results and make us understand more.
There's something you have no idea how I am with you with this idea of sharing and opening up and get this stuff out there and available. But you just mentioned that there was a partnership, and I have the same in orthodontics. Before we can speak amongst peers, and that was behind closed doors. But today, doing this online, available to the grand public to attend, even if usually they don't. What do you think that will do to our profession when there's such paradigm shift happening and the public and the journalists has access to it? Is there any danger?
For all this information to be shared?
Yes, and also for because the information is one thing. After that, it's a narrative coming from this information. So as doctors, we spend so much time to slowly learn humility, because this is something kind of new to us. But to do this on a public place, when people can see a paradigm shifting and say, we thought that was good, and eventually we realized that it wasn't. But this is not a good narrative to the public. We're just going to take the end point and say that, okay, so you were wrong and you were just abusing of blah, blah, blah. Is that a danger here?
Like from any scientific mindset, we always have to be considering the possibility of being wrong. And we always have to be humble enough to realize that a lot of things that we're 100% sure of turn out to be at least 50% of it wrong. And it has been done through the literature, and we've seen it through all the history in science. And that's a fact. So this humbles us to slow down, reevaluate and reevaluate and reevaluate, and try to understand more, try to listen more, and without forgetting that truth as a category does exist. But at the same time, people can have a different point that they're trying to prove and a different mindset. And after examining it and removing all the inclusion and exclusion criteria, and we can see what we're testing, and the lines can be more clear and more refined. And it's okay to think, I think this is the way it should be. I think that's the way that should be. This is the hypothesis in every research. It starts this way, and there's nothing wrong with it. And there's nothing wrong from saying possibly. And when you say possibly, because this is the sense that you've been seeing, you try to examine it. And through a lot of examination and through a lot of years of reevaluation, the reality starts to be more clear. This is what every research is all about. And we have to see things from different perspectives too. We have to see different mindsets and listen to all of them. And this opens up something. And this is why the guidelines keep changing every 5 to 10 years and being more refined, because we're learning more. So the more we give the room to understand more and learn more, the guidelines can be a little bit different. some of them are going to be strict in some aspects, and some of them are going to be more lenient in other aspects because it can be different.
In the whole interview, what I'm getting out here, it's you are reminding us that doctors are eternal learners, always looking to improve their science to give the best to the patient. But this takes humility to know that we don't know it all, that maybe in the past what we were sure it wasn't that sure. And now to have the courage to do this online on a public place, I think that this will be the next challenge of our profession to evolve and to be well accepted by the general population.
Yes.
I have to ask you, I always finish all my interviews on a message of hope with such wisdom and such you're not just wisdom, you put this into action. Where do you see a profession going forward?
I think we need to remember again that dentistry is an art, and art cannot be coded. And I agree and support Dr. Kianor Shah 100% of all what he's saying regarding our healthcare profession in general. Cannot be standardized the way it's standardized. They're overdoing it, and we're overcoding, and we're losing the grip on what we actually want to do best for the patient. We need to remember to personalize for every patient. We need to remember to take our time, to slow down, to implement our knowledge according to what we think best for the patient, not according to what the insurance is telling us this is only can be done this way or that way, and coding everything. Things have to be more thought per procedure, per patient, rather than just simplifying it. We try to simplify, we try to code, we try to standardize just to decrease errors for the young graduates and for the new doctors. But by time, we have to realize again that we have the right to personalize.
Find your passion from personalization. This was Dr. Joseph Nina Atala. Dr. Atala, it's been a pleasure to just listen to you.
It's an honor, Dr.
With such openness. And this is not something we see often in doctors and dentists, to be open. I think that you just bring another subject on the table that we'll have to dig in the next time. We'll be speaking. It's been 40 minutes.
Time flies with you. Dr. Bialak, I love your videos, and what you're implementing as well is just beautiful, like just trying to connect us all together as well. And we're very happy to have you as well with us.
Thank you. It's my pleasure. With this, Dr. Atala, I hope that this is not the only time we're going to have each other on screen, and next time you'll be able to show us your piece of art.